So I'll be showing a 360 of the room. Those are the equipment I'll be using. It's just empty sheets of the paper. It's my patient Rachel. Yeah. And here we go. We're gonna get started. Walk in, provide privacy, close the door. And hi, my name is Annie, and I'll be a nurse for today. And appropriate PPE. Yeah, I'm Annie, I'll be a nurse for today. And can I please have your full name and date of birth, Rachel?
Rachel Parcells, 9/8/1992.
And can I please check your wrist? All right, for second step verification. And can I please, do you have any allergy that you should be aware of?
Latex.
Okay, this is no latex glove, okay? Yeah, so today I'm gonna be a nurse. Do the head to toes assessment. It's basically an assessment to check if all parts of the body are functioning okay. Do you have any questions for me so far?
I do.
Okay, do you know where you are right now?
The Albano College Medical Center.
Do you know what month it is?
December.
Do you know who I am?
You're nursing.
Okay, so my patient is alert, responding to questions oriented to person, place, and time. So overall facial expression, mood, and effect appropriate for the situation. Sitting upright on the edge of the bed, straight up, independently, no assistive device needed. And how are you feeling today?
I feel fine.
And a little bit nervous? No?
Maybe a little.
Okay, and I don't see any lines or tubing assistive device that's being used here, and no oxygen mask, just some room air, and no machine dressing, anything that would negatively affect the mobility. Because do you have any pain that I should be aware of?
No.
Okay, so can I give you 3 words for you to remember at the end of the test? Flower, sharp, pencil.
Okay.
Yeah, flower, sharp, pencil, and no pain I should be aware of, right? Okay, I'm gonna get your 5 steps of the vital sign. Do you, before I do the blood pressure, do you exercise before, eat before, and smoke, caffeine, alcohol? None of that. Okay, can I please see your arm? Yeah. Okay, you have a really strong and good pose. I can feel it through the glove.
Okay.
Yeah. And feet not crossed, and feet are well crossed, but and arms supported at the heart level. Have a really small and healthy arm, appropriate size, and let me see all this thing really quick. Okay, I lost at 122-ish. 122, 22, and I'd be taking my second step in a bit. I'm gonna plus 30 to that, and now I will be. You already stated that you did not eat any hot food, eat, exercise, and smoke, caffeine, alcohol before, right? So this is gonna go under your tongue. You're gonna close your lip gently around it. Beep. Okay, 98, which is in the normal temperature range. And can I please see your fingers really quick? No clapping fingers or cyanosis and on room air. And do you have any? Is there anything like a nail polish, paint I should be aware of? Okay, just in case, I'm just gonna do it at the earlobe, forehead, and the bridge of the nose and toes. Okay, let me warm up the side for you. Yeah. You see that it's at 98%, and temperature is also 98 as well. And can I please check your pulse really quick? All right, so I got that. Respiratory, 13 per cycle. Pulse is 82, which is good range. And I'm gonna take your second step of the blood pressure. And feet no cross, and arms supported at the heart level, and size. Okay, so I got it at 122 earlier, so I'm gonna pump it to 152-ish. So I got the 118 out of 84. You have very good blood pressure. That's within the healthy range. And move on. Can I please palpate your head? And I'm gonna palpate your head next. And just by looking at it is normal cephalic and equal and round symmetrical both sides. And let me see really quick that no infestation, good hair distribution, and good hair distribution, and the skin through head and face and neck is no scar, no lesion, no wound, no bruises, just no damage on the tissue. Skin color evenly throughout face and neck, and no involuntary face tick movement. Anything I can note of. And skin on the face is warm and dry to be touched. And yeah, And that's the face part. And let me see your neck. And neck skin is healthy like face. And neck skin is healthy just like face. And trachea is in the midline and straight. And can you swallow for me? Okay, so I don't see any thyroid enlargement or nodules is being noted, and I don't feel that either. And trachea is straight also. And since I'm already here, can I shine the light to check for jugular vein distension? Tell the other way, no jugular vein distension bilaterally. And I'm gonna be touching your lymph node, palpate your lymph node, and pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental. Okay, bilaterally, cervical lymph node, non-tender and non-palpable. And thyroid, no enlargement, no nodule, trachea, straight. Okay, and we're gonna move on to, that's it, that your hair is distribution is good, and from here, and face hair distribution is good, and skin color evenly throughout, and yeah, no infestation and all of that thing. Move on. Can I move your glass really quick, my dear? And okay, you can hold it, yeah. I see the eyes is equal and round bilaterally and aligned, just that. So can I gently pull down on your eyelid? White sclera, pink conjunctiva, no jaundice, and no drainage, and no nystagmus eye movement. No droopy eyelid is being noticed so far, and just good lashes, and yeah, good eye feature. And move on. So pupil is 3 mm bilaterally, and okay, let me shine the light. Okay, and okay, can I have you staring at that far object, and then staring at the far object first, and staring at the closer object. Okay, and let me check your position, and follow my finger movement. Okay, so pupil is equal, round, reactive, and accommodate, convergent, bilaterally, and they're consensual. And can I taste your 6 visual cardinal sign? It's like here, and here, that, and that, and that, and that, and up, and down. Close one eye for me, and peripheral vision.
1, 2, 1, 2.
Yes, okay, I'm gonna have you read this nail chart. 25 feet apart. 25 feet, okay. Read the first line.
A, B, C, D.
Okay, second line, I'll cover one eye. Second line to the right.
E, F, G, H.
Second line to the left.
H, G, F, E.
Okay, and and I tested your visual cardinal signs earlier. Okay, so cranial nerve 2, optical, cranial nerve 3, oculomotor, cranial nerve 4, trochlear, cranial nerve 6, abducens are all intact. And since I'm already here, I'm just gonna do all of your peripheral nerves. Close your eyes for me. And cranial nerve 1, olfactory, what do you smell?
Alcohol.
Okay, cranial nerve 2, 3, 4, 6, already tested. Bite down on your masseter. Cranial 5, cranial nerve 5, trigeminal, and bite down on your masseter. And masseter and feel temporal, and close again. Where do you feel?
Forehead.
Where do you feel?
Left cheek.
Where do you feel?
Chin.
Okay, and a cranial nerve 7, which is a facial. Lift your eyebrow for me. frown for me. Puff your cheek for me. And cranial nerve number 8, which is the vestibulocochlear. Tell me why I whisper, okay?
284.
284
Okay.
162.
All right, and that's cranial nerve number 8, vestibulocochlear, and cranial nerve number 9, glossopharyngeal, and open your mouth and say ah for me. Okay, I see that all rhymes with that phonation, and okay, all rhymes with phonation, and since you opened your mouth, can I see something really quick? Yeah, no tonsil inflammation or swelling, and I don't see sore white patches, and okay, cranial nerve number 10, vagus, and can you swallow this water for me? So vagus nerve is intact. Cranial nerve number 11, accessory, move hand against my head, move head against my movement, move shoulder against my movement. So cranial nerve 11, accessory intact. Cranial nerve 12, which is a hypoglossal, stick your tongue out, move left to right. Okay, so cranial nerve 12, hypoglossal is also intact, so 12 cranial nerve is intact. I think I verbalized all the cranial nerve with a name, right? Yeah. Okay, so I checked the ear. Now I'm gonna be checking your ear. I'm just gonna take a look at it first. Take a look at it first. So ear is symmetrical, equally aligned bilaterally, just like eyes is also aligned bilaterally. That, yeah. Is there any pain or tenderness when I do it?
No.
Okay, I don't notice any lumps or bumps, and there's no drainage. Just like ear is no drainage, no scar, no lesion, no wound, no inflammation, no bruises. And can I please remove your glass really quick? Okay. Frontal sinuses and maxillary sinuses. Pain, tenderness when I do it?
No.
Okay, no pain, no tenderness when I palpate. And I don't notice lumps and bumps either. Yeah. And then let me see, the nose is within the midline. Nose is straight in the midline, and all right. And I don't see drainages. So nose is like no drainages, no scar, no lesion, no wound, no bruises, just healthy and straight in the midline. Can you open your mouth for me really quick? Yeah, I already said that. No missing teeth or denture, oral tissue, tongue pink and moist, and oral mucosa, and pink and moist tissue, and no scar, no lesion, no wound, and no sore white patches. And I already said that no tonsil inflammation is being noticed. Let me just double check. Tonsil is very important. Yeah, no tonsil inflammation or swollen. And okay, move on. That okay, I did the face and neck and ear and eyes. And, okay, so I'm gonna do your respiratory exam. Move on. So our respiratory, that is on room air, sitting upright, straight, just breathing on her own, and no, she's on room air. Yeah, she's on room air since vital test, and yeah, appropriate inspiratory and expiratory effort them by chest. No labored breathing, dyspnea, no, just it's regular breathing. Yeah. And then, can I please put my hand on your chest? Breathe in and out for me. Breathe in and out for me. And appropriate chest expansion, anterior and posterior. That, okay. Appropriate and equal chest expansion, anterior and posterior. That I'm gonna osculate now. Your last sound. Just breathing in and out for me, okay? In and out. In and out. In and out. Sure. Okay. So I got the clear lung sound is being osculated, and clear lung sound is being osculated, and appropriate rate of breathing, and no adventitious lung sound is being cut. Just because I think I hear you swallowing when I was listening to your lung. Let me just okay, swallow for me. Okay. Just to make sure, okay, no thyroid enlargement or nodules is being noted, and no adventitious lung sound, clear lung sound, appropriate rate of breathing, osculated, all lobes bilaterally, left and right, anterior and posterior. So lung sound from all lobes are clear, no adventitious sound. Yeah, okay. Can I please move into, and for respiratory sound, usually it will be done directly on the skin, but for purpose of this recording, I'm gonna do it over the cloth. Yeah, and now we are moving on to heart, and can I please see your fingers? Squeeze. Okay, so capillary refill within 3 seconds. Capillary refill within 3 seconds. Can I see you both of your hands one more time? And no cyanosis or clapping finger is being noticed, and I see that. Okay. Let me palpate your carotid artery. And the other one, 2 plus, bilaterally equal and symmetrical, and can I please osculate your carotid artery? And the other one, okay. No murmur and bruit heard at the carotid artery. Clear sound. Listen with the bell. Nothing cut. And shine the light to check for jugular vein distension one more time. Yeah. No jugular vein distension is being noticed, and I'm gonna be listening to your 5 landmark of the heart. Usually be done directly on the skin, but for the recording, it's gonna be done over the clothing. So, sorry. I'm gonna be at your right side. Okay. 2 down, right intercostal space, right sternal board. I have the aortic, and 2 left sternal board, 2 down intercostal space. I have the pulmonary, and left sternal board, 3 intercostal space down. I have the Erb's point. Left sternal board, 4 down the intercostal space. I have the tricuspid, and midclavicular, 5 intercostal space down. Left sternal board, I have the mitral point. And I'm gonna be osculating everything again with the bell. It's gonna be usually directly on the skin, but for recording, over the cloth. 2 intercostal space down at the right side, which is aortic point. Left side, left sternal board, 2 intercostal space down, pulmonary point, and 3 intercostal space down the left sternal board, gonna be Erb's point, and 4 intercostal space down at the left sternal board is gonna be tricuspid and mid-clavicular 5 intercostal space down at the left sternal board, which is gonna be the mitral point. Okay, S1 and S2 usually with a diaphragm, S3 and S4 usually with a bell, and just clear heart sound. I mean, appropriate rate and rhythm for the heart sound, and for S1 and S2, and no S3 and S4 heart murmur or brewy is is being heard, and yeah. No, just no S3 and S4 sound is being heard. And can I please palpate all your pulses, peripheral pulses, and let's see that brachial and radial. No femoral for the purpose of this assessment. Popliteal, posterior tibial, dorsal pedis. Yeah. All the pulses 2+, bilaterally, symmetrically, equally, and I be also checking your can I checking your pitting edemas as well? Yeah. Usually I be direct feeding my patients on the skin, but for recording it's just gonna be done over the clothing. And okay. Actually, I take a look. Let me see. Alright. No pitting edema in all extremities, legs and arms. Just all extremities, none of that. And can I please see your skin? I think I already mentioned that when I was checking your face and neck, and your skin is warm and dry to be touched on the face and including on the arm. Good hair distribution and good skin color throughout. No damaged tissues, and slightly petechiae and freckles noticed. But overall, no scar, no lesion, no scar, no lesion, no wound, and no drainage, no bruises. Slightly pigmentation due to the sun. Sun protection is probably important, yeah? And yeah. Just gonna see the exposed skin. Usually be looking at skin all over the body. And let me check your hydration. Under the clavicle, give it a little pinch. Okay. I see that no tenting, which means good hydration. And can I please check your abdomen, please? Yeah. Can you lay down for me? Okay. I'm gonna be at your right side. Okay. Okay. This is done directly on the skin. I'm directly assessing abdomen skin, looking from a different angle. And can you bear down for me? Yeah, bear down. So I see that abdomen is flat and symmetrical, good hair distribution, good skin color evenly throughout. No obvious pulsating, no obvious pulsation, and just no obvious pulsation, and yeah, just very healthy abdomen skin, no damaged tissue. And no no umbilical hernia or linguinal is being noticed. And can I please listen to it right now? I'm gonna be at your right side when I listen to it. Okay, it's done directly on the skin, and I'm starting 2 or 3 quadrants in each. If I got abnormal sound, I'm gonna listen to each quadrant for 5 minutes. Okay. Right lower quadrant. 2 or 3 area each quadrant. Upper right quadrant. Left upper quadrant. left lower quadrants. Okay, after all of that, I see that I heard that I osculated that the abdomen sounds are like normal active vowel sound, and let me listen to the abdomen aorta. No murmur and bruit from the abdomen, aorta, and normal active vowel sound. No, not anything irregular that I should be documented. And yeah. And can I please palpate each quadrant? Right lower quadrant, there any pain when I do it?
No.
Upper right quadrant, any pain?
No.
Tenderness, no?
No.
Okay, left upper quadrant, pain, tenderness.
No.
Lower left quadrant.
No.
Okay, no pain and tenderness in all quadrants, and no pulsation, right? Okay. Okay. It's flu season. Do you have any cold? Okay. Yeah, because yeah, you have no drainage from ear and nose and like oral tissue, which is a sign of you're at very good health, as I checked earlier. Yeah, but as I was palpating your abdomen, just very normal active bowel sounds and no pain, no tenderness, no involuntary guarding. Yeah, and so now skin is warm and dry to touch. No pulsation, as I can feel tenderness, lumbar bumps, and okay, can I please have you standing up, and you're gonna walk, you're gonna walk from here to the door, and you're gonna walk back heel to toe. And you're just gonna walk like straight over there. Just normal position of walking is okay. And then walk back to the bed. Okay. So steady gait, good balance, and a good posture, balance intact, and able to move independently. Steady gait, good balance, and yeah. And ambulate independently, and I'm gonna palpate your joints, shoulder, elbow, wrist, hip, kind of here a little bit, hip, and knee, and ankles. Is there any pain, tenderness when I do it? Okay, so no pain and no tenderness on all joints. No pain, no tenderness, no swelling at the joints. And can I see your back? And curve your spine for me. And then let's get up. So no pain, tenderness when I do it. No pain, no tenderness, and then no swelling at the spine joint. Spine is straight and in the midline. And I'm gonna have you mirror my movement, okay? So shoulder movement. And elbow, wrist, and you're gonna move your hip, and we're gonna do some kick movement, yeah, and then heel, and ankle movement. So yeah, patient is able to mirror my movement, equal range of motion bilaterally, and flexible joints, and actually. Okay, I'm gonna do the lumbar test, arm around the shoulder, and for 10 seconds. Close your eyes, yeah? Okay, negative lumbar test, you may sit now, and so negative lumbar test, balance intact, you have balance intact, and you have good balance, good posture, steady gait, and yeah, just you have really good balance and no assistive devices needed, and really independently. Do you remember the 3 words I gave you at the very beginning of the test?
shirt, pencil, flower.
Yes. Yeah. Do you remember where you was born?
Atlanta.
Okay. Do you know what month it is?
December.
Okay. So I'm gonna. Okay. My patient's remote, immediate, most recent memory is all intact. That is all intact. That now I will be checking your deep tendon reflex. I'm gonna be checking your deep tendon reflex. Okay, it's probably more comfy if we get the bed up a little higher for you. Okay, this is comfy for you? Yeah. Back. Okay. Usually it be done on brachioradial, tricep, bicep, achilles, and patellar. But for the purpose of this assessment, just gonna do on the patellar. Okay, I'm gonna do it again. Okay, 2+ bilaterally brisk deep tendon reflex, and 2+ bilateral deep tendon reflex on the patellar, and yeah. Just I already tested 12 cranial nerve earlier, and one thing I forgot to mention, when I was palpate your ear, I don't notice any lumps or bumps or tenderness, and you said no pain, right? And usually I do the femoral pose, but for purpose of this assessment, I did not do it. And all your peripheral poses are 2+ bilaterally, symmetrically, and equally. I think I mentioned that pretty well for you. So you're in a very healthy state, and tested 12 cranial nerve, and those marks at the end of your head to toes assessment, and you may be back lying in the supine position. That raise the side rail, and safest position, call light within reach. Do you have any questions for me?
No, I don't. Thank you so much.
All right, let me know if you need anything.